so a neurosurgeon will remove the bulk of the tumour, and then the patient is given typically radiation and chemotherapy, these toxic therapies. We know that they're effective, but we know in many cases those tumours will recur, they'll come back in those patients, and also the patients who do well are left with lifelong problems from those toxic therapies. We're working on a particular receptor called FA3, which we've shown is highly expressed on children's brain cancer and not normal brain. So we're developing approaches using antibodies to specifically target the tumour and not the normal brain. We know that they're tumour specific, so it gives us a way to target the actual tumour cells at its roots whilst not affecting normal tissue. So we're very, very interested in that in the context of paediatric brain cancer, because we don't want to target normal, healthy children's brain. We want to target just the tumour cells. The particular name of this therapy is called an antibody drug conjugate, and the idea is that we have a toxic drug attached to an antibody, and then we were able to deliver that directly to the tumour cell where it's pulled inside and kills the tumour cell and not the normal brain. This particular project has been a long-standing project in my scientific career. I've been working on this for some 14 years, and I started working on this in adult brain cancer, where we were able to show that this particular receptor was on the more stem-like cells, which we know are responsible for tumour initiation and recurrence. And we've now taken that line of work through to a clinical trial, which is actually ongoing at the moment in recurrent adult brain cancer. And we thought that a similar process may also occur in paediatric brain cancer. So we started a line of investigation looking to see if this particular receptor, FA3, was in paediatric brain cancer and potentially doing a similar thing of what it was doing in the adult setting. And we found that to be the case. So we've now piggybacked, I guess, on a large project where we know a lot about it in adult brain cancer, so we can take that toolkit and actually apply it to paediatric brain cancer and speed up our discovery pipeline. When you have a breakthrough, it really is a satisfying feeling, and when all those little pieces of the puzzle come together, it's a wonderful moment, and particularly when you're able to bring that through to the clinic and treat a patient, it is really a very satisfying feeling. It's really now an exciting time. Like never before has there been so much funding available for brain cancer, both adult and paediatric. So it's, with that funding, with that potential comes, interest, and the funding will enable us to do things that we've never been able to do before.